Hi, I'm Kitty Lamprecht and I'm your physiotherapist. This is just before your operation and you are going to have a TLIF or a transforaminal lumbar interbody fusion. It's a very big word and I'm going to try and explain that to you. But before we do, let's talk about the back and how movement takes place in the back. So movement in the back takes place over two columns. The first and the front column, so that's where your stomach is, we have an intervertebral disc. And the intervertebral disc is like a balloon with jelly in it. So if we can imagine that I would take a balloon and put jelly in it and then put it in between two bread planks, though the bread planks represents our vertebral body, which is just a bony, solid piece. And the disc, the balloon with jelly in between. So you can move over it, you can, it's a shock absorber. But you must always remember that if I push very hard on the bread plank, this balloon with jelly in might burst. And that is basically what we do in our lives. Because the disc have got an outer rim of ligament and a soft center, it's got pressure, like we have blood pressure. And it basically does what blood pressure does. So if we push our blood pressure up, we can stroke. And so over time, the disc basically stroke too. So it tears the outer rim and some of that jelly comes out. We must also understand that the function of that jelly is threefold. One, it keeps the space, and two, it is the shock absorber, as we discussed. But at the same time, it also is a base of nutrition for the cartilage. Then at the back column, we have got small facet joints. Now, facet joints are like any other joint in the body. It's got also cartilage, and it's got a little capsule around with some fluid inside. The fluid is important because it also feeds the cartilage and the facet joints in itself guide movement but also restrict movement. So the way that we handle our back, and especially nowadays with we sit a lot, gradually our disc degenerates and so does the little facet joints, and that is basically where you are, because as the facet joint deteriorates, the capsule can thicken and narrow the canal for the nerve. But as the disc deteriorates, then its space-keeping ability deteriorates and the vertebrae moves closer together and the canal is in any way too narrow. And that is why you have so much pain in movement. So what are they going to do? Well, firstly, they are going to go in and part of the disc is removed. And then a spacer is put in between the vertebrae and that is backed with bone. So in time, as the bone grows, that will fuse the anterior column. Then from the back, little screws are put into the facet joints, and that is also packed with bone, and that would be your posterior column fusion. So in the end, in time, you are going to have a two-column fusion, and that is important to understand, but also important to understand that that is going to be formed over time. The most important thing, and I'm sure that we all have had numerous people that told us about the risks involved with fusion and the fact that they know somebody's auntie's uncle who had a fusion and a failed back. And the reason is that we have to understand that after the operation, the fusion very little can happen with it. Things can go wrong with a fusion, but the most important thing is the disc just above your fusion. Because you have a solid piece in a chain, that disc is under tremendous pressure. And so part of our program is mainly to look after that disc and teach you how to protect it, so that you don't have any future problems. But the next thing I want to talk about is what happens just after the operation. So the first thing, when you wake up, you will be in intensive care, you will be lying on your back. For most people, and when you wake up, they don't have that much pain because during the operation, morphine is injected into the sac where the nerves are. So that helps for the first day. But people notice that that there is something around their calves, that it feels like their calves are being massaged. It's quite nice, but it should be there. The compression helps your circulation, and it is quite important. So if you don't feel that, please notify the nursing staff, because it should be, and it should be working. Secondly, the reason for lying on your back is to give compression on the wound, and that minimize the amount of bruising around the wound. And that you must do for the first 4 hours. After that, it is a good idea to ask the nursing staff to turn you. It helps to minimize the stiffness in the muscle if we turn a little bit, and I can promise you most patients find that their bum gets quite numb from lying on it for such a long time, so it's quite a relief thing to turn. You will also have a catheter in. You will be have a monitor connected to you, and you would have some drips in so that you can have your pain medication. It's quite important. Take your pain medication. Just remember that pain medication takes some time to kick in, so don't wait until you can't stand the pain anymore. Ask for it, and make sure. We want you to be as comfortable as possible. It makes movement so much easier. Then we cannot sit up. So when they want to give you anything to eat or to drink, the best thing is either from the side or the whole bed. The straight bed can be tilted like this, so that you halfway in between standing and lying flat. Then the next day we will come, and we will help you and turn by yourself. We will do some exercises, and the day after the operation, we will stand up. Just remember, your brace will be given to you while you're in hospital. So just please bring a tight-fitting t-shirt or a vest to wear under your brace. So I hope this helped, and we're looking forward to see you.